A doctor in Ontario is suing his own hospital for millions after he was put under a microscope over the alleged murder of a patient, an investigation he only found out about after he was cleared. CTV's medical correspondent Avis Favreau has this exclusive report.
For over 3 decades, Scott Anderson has been a critical care doctor in ICU and emergency. But now he's suing his hospital for over $6 million after finding he was never told he was the target of a patient review looking for possible murders.
I had every emotion you could possibly have. I had sadness, I had dismay, I had the sense of betrayal.
In this exclusive interview with CTV News, Dr. Anderson revealed it was all triggered by a single complaint made last year by a former nurse who thought he might have murdered an elderly patient back in 2014. The hospital quietly investigated, expanding it to a review of some 600 hospital deaths looking for cases involving Anderson. But the doctor only found out when he was cleared and blocked from getting any further information.
I've tried on more than 10 occasions to get a copy of the complaint, to get answers as to who conducted this investigation, how was it conducted, who was involved, and at no time have they been willing to meet with me or talk to me about this in any way.
We don't understand why he's been treated this way. He's a long-time, valuable employee of the hospital.
In an email, hospital officials write, "As this matter is before the courts, London Health Sciences Centre will not be commenting further." But in court documents, they do confirm there was a highly confidential investigation, denying they owed a duty to tell Dr. Anderson.
It creates this really toxic working environment for physicians, and the hospital gets used to never being challenged. And then they make these broad and arbitrary and overbroad decisions that really impact physicians' lives.
Rather than share the investigation documents, the hospital has hired a Toronto law firm to take the case to court, which could be costly for taxpayers if they are found at fault.
It's a really hard time to be in healthcare, and you need to feel like your hospital and your government has your back.
Dr. Anderson, meanwhile, continues to work at the hospital that he's suing, saying the case isn't about money, but about getting critical information about his career. Avis Favreau, CTV News, Toronto.